Now, coming to soft tissue pathology properly, we'll get to look at the overview, which you'll be looking at the general features of soft tissue pathology. Then also look at the pathogenesis, okay? Soft tissue pathology and pathogenesis. Okay, so what we have here is, as a way of introduction to soft tissue pathology, you know that there are actually a diverse group of benign. That's, they could be friendly stuffs and they could be malignant, okay, having that possibility of spreading to other places. So they could be benign or malignant tumors, and they arise from some specific types of tissues. That's why they actually call them soft tissues, okay? So they arise from fats, they arise from muscles, they arise from fibrous tissues, they arise from vessels, they arise from peripheral nerves, okay? So the pathogenesis is usually linked to genetic mutations, some one or two issues in your genes, chromosomal translocation, abnormal signaling pathways, and all of that, okay? So let's discuss it in depth now. So we'll start with the pathogenesis, okay? So many things could actually cause pathogenesis. Is like you are trying to say, okay, what can actually cause a soft tissue tumor? Okay, so it could be genetic alterations, right? So many soft tissue sarcomas are driven by specific chromosomal translocation, okay? Mutations in tumor suppressor genes. So there are some genes that are supposed to stop cancers from coming in. So if those genes are disrupted, of course, cancers can now just have a clean stepping, nothing is stopping them. Do you understand? The molecular pathways, so sometimes it's the dysregulation of growth factor signalings, okay, and the rest of them. So cells of origin. So tumors arise from primitive mesenchymal stem cells that are capable of differentiating. Like they can actually attack the stem cells. The stem cells that could become adipocytes, could become fibroblasts, do you understand? Could become muscle cells, could become blood cells, and all of that. So when those tumors arise from there, you can now have all those issues coming in. Then sometimes you have environmental and trauma factors, where sometimes it's chronic irritation, okay, trauma, sometimes is due to radiation exposure, okay? So probably you have been exposed to some one or two x-rays, okay, then can cause you cancer and all of that. Epigenetic changes is DNA methylation, histone modification patterns. They usually influence tumor progression and aggressiveness, okay? So what are the general features of soft tissue pathologies? They are rare, okay? So if you are trying to combine all the cancers in the world, okay, soft tissue pathologies are like less than 1% of it, okay? Age distribution. In the pediatric age, that's in children, you have mostly rhabdomyosarcomas, Ewing sarcomas, a lot of them, okay? We're just trying to list, like for example's sake. In adults, you have things like liposarcoma, leiomyosarcoma, undifferentiated pleomorphic sarcomas. So clinical presentations is most of the times they're even painless, but you see a swollen mass so big, but the person having it is not even complaining, okay? They are deeply seated, so most of them they occur so deep under. So histological diversities is they have a wide range of morphologies: spindle cells, round cells, pleomorphic. So diagnosis require you doing histology, immunohistochemistry, molecular testings. So biological behaviors is, most of them are benign. You can also have intermediate ones. They can also have malignant ones. Those ones could spread to other places. And one of the complications that usually kill patients is when they metastasize to the lungs. Okay, they cause complications in the respiratory tract. So prognosis actually depends on the type of the cancer that you are dealing with. So answer this question trying to talk about the general features of soft tissue pathologies and the pathogenesis.